Pandemic Transforming Radiology, Roadmap for Success. Joining us for this panel, we have Dr. Meinal Chaudhry, Director, Radiology Hospital. Welcome, sir. Thank you so much. And Dr. Sangeet Bhalla, Lead and Consultant Radiologist, Medeor Hospital. Welcome, Mr. Bhalla. Thank you so much. I hand over the session now to Dr. Meinal Chaudhry to take the discussions forward. Over to you, ma'am. Thank you.
Thank you so much. Good morning, everyone. And let's start this day and looking forward to an academic feast during the day. So I welcome my fellow colleagues, Dr. Dhawan and Dr. Bhalla. So as we all know that COVID has actually given impetus to the ever-changing landscape of radiology. So it was already there, but the adaptability of various things it has catalyzed the adaptability. So my first question to Dr. Dhawan would be, sir, in your setup, how do you see, what are the changes you've seen the pandemic has brought into your processes, practices, infra, anything?
Yeah, thank you, Dr. Meinal. Thank you to the organizers for giving this opportunity to share my thoughts. And morning, Dr. Bhalla. So, the pandemic has been a revolution. We have never seen this in our lifetimes. We were not expecting changes to this scale. And I would feel that the radiology practice has evolved over the pandemic. There has been a lot of adaptations. There has been changing in the kind of patients we see. There are changes in the workflow. It has affected the mental health of the staff, doctors and community. And we have gone into the use of technology more than we were using earlier. And the good point is that, we have gone into use of technology, but the technology has been accepted during this pandemic. So that was something which was lacking earlier. We were trying to push it, but the acceptance was low. But for the pandemic, the circumstances were such that people were forced to accept it and they liked it. And lastly, there have been changes, a lot of changes in the education of radiology, in training of radiologists. So I would say that we have, in these 2 years, we have really come a long way. For example, if I comment on the workflow, earlier we used to do all kinds of imaging. Suddenly the cancer patients dried up. Suddenly the other diseases dried up. We stopped doing health screenings. We were all focusing on the COVID cases. And this kind of, necessitated a change in the resources, change in the budgets, and the fact that people who were being afflicted with COVID, the healthcare sector staff was not spared, right? And to run the department with short staff, with few people, how do the services are provided round the clock? So different challenges, but I think in general, if I have to close the opening remarks by saying, I think we have come out of this well. We made some changes, we adapted well, and yeah, we did well.
Great. So I would project the same question in a different manner, Dr. Bhalla. So after the dust has settled now, what are the positive changes you've seen in the practice of radiology? Operationally, financially, technologically. What are the positive things we've come out of it?
Yeah, hi. Very good morning to everybody. Thank you for the question. And indeed, radiology has always been at the forefront of telemedicine, being one of the first branches to diversify into the technology vertical. Despite of all the shortcomings during the pandemic, as sir has mentioned, the staffs and everything, and even the mental and psychological stress that all the medical fraternity had to go through, working endless hours and trying to make ends meet for the patients. We have come out strong from this pandemic, and we have learned a lot. I think technology has taken its front seat and driven us through this pandemic. We have seen new novel techniques come up. We have seen 3D quantification and all sorts of new techniques come into CT imaging, and hopefully these imaging techniques which have come out of all this pandemic will also be applied into future in different pathologies, into maybe cancer imaging of lung and all this. And definitely one thing I feel is that within the time of the pandemic, we have seen a lot of CT and X-ray setups come into second and third tier cities. And these diagnostic services were much required in these areas where our physicians and surgeons were, facing problems with diagnostic, modalities. And all these new setups in the second and third tier cities will add to the, diagnostic capabilities of these cities, and will be a positive drive for radiology in the future. And we will gain a lot out of it, and the patients will be happy that they will get the required, diagnosis. And the positive thing is you don't require to commission a radiologist there. We can have, tele-reporting. So a person based out of a metropolitan can provide their help into the, urban and suburban and rural areas. So that is one positive thing which has come out from the pandemic, I feel, and will be a roadmap to success for radiology.
Wonderful.
Thank you.
Thank you so much. So I think, as Dr. Dhawan said, that adaptability of technology is more after the pandemic. So a little positive change, what I see in my department, is that initially clinicians were not very happy when we used to give them images on packs. They wanted hard copy. They wanted hard copy report. Now, after the pandemic, they want the whole thing, like a video of MRI or a CT or an X-ray on their mobile. So, which is eventually, we are doing away with the, cost to the patient, film cost and, camera cost and all of that. So I'm looking forward to a world when we are completely paperless, filmless, we are just on mobiles and screens. A lot of junk would be out of the system, I think. This is one small change which I have seen. Also, I feel because of the usage of EMR, because now doctors, the clinicians, our fellow clinicians are adapting to EMR. So radiologist from just a diagnostic person is moving to a clinical care team person, because we are now not getting shoddy histories, we are getting good histories on EMR, labs are available on EMR, we can, see what is the progression of the patient. So I think there is a major transformative positive change which has come to the radiologist, and I think it's a very, very welcome change. So thank you for bringing that thought. My next question for Dr. Dhawan would be, so as you mentioned that the technology adaptations and technology innovations are its all-time peak. Can you give some insight into the artificial intelligence and the way it is moving inside, into the the way it is foraying into the radiology? What your thoughts on that? And what the pandemic has led to. How much is the role of the pandemic in this?
Yeah. So just another point before I go into artificial intelligence about acceptance of technology. I had seen in practice that radiologists earlier was not very keen to do reporting sitting at home, though I used to tell them that be flexible, unless if you can promise me that you will finish the reports from home, I don't have any problem. But because of the circumstances in COVID, They didn't want to come to hospital over this exposure of risk. So they were happy doing it, and then it transpired and they kind of shared with me that yes, this can be done. There's no problem. Similarly, these voice-enabled softwares, I mean, we were used to reporting, like dictating, and the typists sitting next to us, taking on the reports. But courtesy the pandemic, I have not used a transcriptionist for the last 2.5 years. I use that voice-enabled software and it works very well. And I'm so used to it that I'll probably use that only coming to future. Next is the artificial intelligence part. So artificial intelligence has been in works for a few years now. I must clarify that artificial intelligence as of now is like development of some tools which help us in specific parts of generating a radiology report. It has not come to a level that it can substitute a radiologist in the sense giving the entire report. But yes, there are places like where it can help the quantification parts in the report. COVID, we saw softwares being developed which were able to identify and score the COVID pneumonia severity as a radiologist used to do visually. So that came in very handy. Similarly, because of COVID, when the staffing was inadequate, there are some softwares available for emergency radiology like detection of hemorrhage, detection of fractures. So they kind of get more acceptance during this pandemic. And I see that in future there is definitely a large role for artificial intelligence. The challenge really is how it is integrated into the routine practice and how, I mean, we cover the various medico-legal aspects which are associated with generating a report without human intervention. So, but yes, we are seeing a lot of movement on fractures, on hemorrhage, on pneumothorax, on pneumonias, on, even detection of lymph nodes, generating a report for a mammography examination. So yes, screening, like health screening, there's a lot of role for artificial intelligence because the numbers involved are very large. If in a tuberculosis detection program, you have to screen 10 lakh people, so imagine the number of radiologists it will take to kind of screen those tests. So all these places, artificial intelligence has a definite big role in the future.
Oh yeah, that's absolutely wonderful. So I think because of the need for the contactless execution of medicine, I think auto selection of field of view, auto generation of reports without a human intervention, I think pandemic has really led into a lot of such innovations which will eventually be with us forever now. So the same question I will project to you, Dr. Bhalla. How do you feel that AI and its adaptability has been catalyzed by the pandemic?
Yeah, so again, catching up with what Dhawan sir said, that the acceptability right now is starting to develop in the field of radiology, and definitely there are some softwares which are helpful, like for mass screening and things, but my personal opinion would be that the radiologist himself or herself is an irreplaceable tool for the medical fraternity. Be it we can develop n number of softwares, and it can generate the probabilities and the positive predictive and negative predictive values of the tests, but still that human touch will be required, and we openly accept AI as our tool, as a help, and it is here to stay, and definitely it will develop over the future and provide us more information and maybe guide us as to what we were doing wrong and what protocols need to be changed according to computer-generated modalities.
Yeah. So wonderfully said that it's a machine which counts, but the man behind the machine is never irreplaceable. So Dr. Dhawan, please elaborate about the adaptability of, as you said, that the radiologists are now happy doing the tele-rad, and they are, so how are you maintaining the quality of reportings, and what are the issues you see in teleradiology within your organization? And if you take up teleradiology from far-fetched, say tier 1, tier 2 areas, what are the issues really you foresee in that?
Yeah, I think that's a very good question. So see, it's a different thing altogether to run a teleradiology within the department, because we are a close-knit group. We can pick up the phone, we can discuss the cases, we can take a second opinion. And I honestly have not seen any dip in quality because of that. If suppose there are some cases which need to be seen again on the workstation, there's always this opportunity of going back to the department and having a look and generate a good report. As opposed to a teleradiology service, if we choose to provide for some other cities or from somewhere else. So the biggest problem or challenge I feel in that is that the data quality is not up to the marks. Like if I have a set protocol for doing a particular study, I am happy if I get those sequences, I get a study done as per that protocol. So I have to tailor that for the person for whom I am doing teleradiology. The second thing is the lack of clinical details which comes with such images, and the lack of a scope of communication with the doctor who has referred the patient. Ultimately, you know, the aim is to alleviate the disease or suffering of the patient. We are not treating images, we are treating diseases. And what images we see on scans are representative of a pathology. It is not that we see an image and we can see tubercular bacilli there. So we kind of interpret findings which could be seen with a particular pathology, and then most likely this disease. So evaluating the images in the light of clinical findings and the patient's complaints is paramount. This suffers a bit when we do a remote teleradiology. So yeah, that's like what I think about the question.
So here I think the take home what we can take, if people are sitting who are into the structure of artificial intelligence, I think the take home point would be that if we make the use of artificial intelligence in acquisition of images, choosing the correct protocol, doing the quality check at source rather than I mean, of course, we are doing, we are implementing artificial intelligence in reporting, but here the scope what we are bringing forth is at the acquisition of images and the quality check and the completeness of data. If we kind of use artificial intelligence there, I think it will increase the access of a good radiology program to tier 1 and tier 2 cities. I think that's a great take home we have brought out here. So what do you feel, Dr. Bhalla? How is your experience with teleradiology and the issues you face?
Yeah, so the basic issue and the foremost is definitely the clinical detail, which is most of the time not there when you're doing remote radiology. They expect us just to see the images and generate a report, and a report is a clinical document which is generated on the basis of some prior information we get according to the clinical details, maybe some blood work, some other prior operative histories, which mostly are left out in case of remote teleradiology. That is one reason why the quality of reporting is not up to the mark, I feel. And second, yeah, definitely a lot of untrained professionals are doing these scans who are not up to the mark. and they generate images which can generate false impression of disease maybe sometime because of improper technique, and they might even land up a patient into trouble because doing contrast studies has its own disadvantages of contrast reaction, which in tier 2 and tier 3 cities might be underestimated by the people who are generating these telecenters or these. So clinical detail and definitely the image quality, because a lot of these tier 2 and tier 3 cities are using scanners which are really low image resolution, maybe 2 slice, single slice, and then they expect the reporting to be on a level of a higher machine, which definitely is not going to happen, because that is the whole reason radiology has transitioned from a single slice scanner to a helical 128 to 56 slice machines. That is the reason we want more data. We want clear images to perceive and report those diseases.
Just to add on that, we talked about the quality of scanners and the quality of images, but a report, there's a difference between a report and a good report, or an incomplete report and a complete report. So the teleradiology is done by a lot of people in India, and the training and skill set of the reporting radiologist is also important, which should be is one of the important things.
So yeah, so this is the issue we have seen after the pandemic. There is a lacuna which needs to be, there is a gap which we together will fill by increasing the role of artificial intelligence and quality of images at source, and also increasing the skill set of the radiology residents and radiology doctors to handle teleradiology, so that we reach up to the level of a good reporting rather than just reporting. Thank you for that. You also mentioned that there is a marked change in the way academics are handled now after pandemic. So kindly give some details on that. How do you think that is happening?
So that I think is the biggest positive we have gained from the pandemic. The negative part of that was it affected the training of radiologists very severely. Suddenly radiologists who were in training became COVID radiologists, because no other patients were coming to their hospitals where they are training. And the other was the huge shift from this offline meetings to online meetings. Because radiology as a specialty deals with images, so data reproducibility these days is very easy. It was very, very easy and convenient to hold teaching sessions online, which could be accessed by everybody sitting at home. So I think that is the biggest gain from this scenario. And honestly, it's always good to meet people, interact with people. But I think online meetings are a great way of disseminating knowledge at a lesser expense, at the convenience of the speaker as well as listener, and without any loss of gain, at least in the setting of radiology. So that was something which I was very happy as a kind of a positive outcome. And I must commend, the radiology community as such has been very, very forthcoming to come out and speak at these sessions and teach the junior colleagues, because that mentoring is very important. And our association, IRIA, took a big lead. I remember, there was a time every evening from 7 to 9 p.m. there was a session on some topic just to enhance the skill set and knowledge. So that was good.
And I also remember IRIA has made a Guinness record of highest online teachings during the COVID time. So that's commendable job which IRIA has done. Also, I've seen various portals where you can add learning material to the cart, just like shopping the material. So if it is musculoskeletal radiology, you add to the cart for say, 3,000, 4,000 bucks, and you listen to professors of various, I mean, not that Indian professors, there is, I mean, you can listen to professors from US, UK, Oxford University, Stanford guys, at a very, very low cost. So this came up as a positive from the pandemic. Not that Indian professors are any lesser, but I think we are so much deep into work and so busy that sometimes the academics take a backseat for us. But so here, in the pandemic, when IRI got a Guinness record and various other radiology portals were accessible to all the residents and us, it was a huge, huge learning experience and a huge, huge gain for all the radiologists. Thank you for that, Dr. Dhawan. Dr. Bhalla, one question which comes to my mind is there any changes in the processes, like your operational flow in the radiology department, which happened during the pandemic and is now with you forever? So any change in the processes you've made? And
yeah, definitely there have been huge, and one of them, as you mentioned, is the take up of the EMR and HIS by the hospitals, and all the clinicians have openly accepted that. So that has streamlined processes. We can pick up all the details on the go in the radiology department. We don't have to call the floors and IPTs for the files. We have all the data, all the operative notes. Everything is available to us through the HIS, and this has definitely streamlined the process. It has reduced the turnaround time for the patients. We don't have to wait for the files to arrive to, maybe generate a report. We already have that on hand, and that has definitely streamlined the process.
Yeah, that's, I think, a brilliant, brilliant change which has happened due to the pandemic. And also, in our department, we have seen that there is marked reduction of infections. And because during the pandemic, we are now so used to doing surface cleanings and all. So I've seen marked reduction in infections. Besides that, in our department, we used to make pink corridors to segregate patients. Like a certain hallway was used for COVID patients, and a different hallway was used for non-COVID patients. So now we used to call it pink corridor. Now after the COVID has settled, we use the same pink corridor for immunocompromised patients, for like patients of liver transplant who are being moved to Department of Radiology. We segregate the corridor and do surface cleaning and move the patient. And so a kind of safety which has notched up because of the practices we learned during the pandemic has stayed with us even after the pandemic. So I see there is a lot of infection control measures which have notched up in, I think, all the hospitals across the nation. So that, I think, is a welcome change. Dr. Dhawan, same question to you. Any change in the processes which has really led to betterment of the radiology department and services due to the pandemic?
Yeah, actually, we could, again, at the sake of some repetition, we were able to streamline processes more. COVID necessitated that we offer certain services at fixed times to prevent spread of infection. We had specific time slots for CT chest of COVID patients. And, earlier what used to happen was that whenever we used to try to do slotting for anything, there was a massive resistance from the clinicians. No, everybody wants his patients done first. Nobody wants to wait. But again, this led to a certain level of acceptance that, okay, workflows and processes have to be maintained. And one of the things I think we have not mentioned is the huge stress our team went through during the pandemic, wearing PPE for hours on, and it was difficult in this harsh weather, but they kind of stuck to it. I mean, it was ultrasonologists roaming around in like spacesuits like PPE. It was not a funny sight at all. But yeah, again, we delivered. And this, I really like the point you mentioned about that the infection has come down. which is true. I think we all are more cautious about our personal hygiene. We are all more cautious about wearing gloves and wearing masks, and overall that has a positive impact on the health part.
So, any final remarks from you, Dr. Bhalla, before we close the discussion?
Yeah, I think we have come out strong as a team, the whole hospital and healthcare system in this COVID. We've learned a lot of things, resilience, acceptance to a lot of things which we were not very open to, and definitely it has a lot to teach, and we'll keep learning and keep adapting as time changes and as things come forward. Yeah, thank you.
Thank you. Any final closing remarks from you, Dr. Dhawan?
Yeah, similar lines as Dr. Bhalla. Pandemic was unfortunate. We adapted, we changed, and I think we delivered. But COVID is not finished as yet. So as I say, picture abhi baki hai. So we hope that in the future we'll also continue to adapt and continue to deliver healthcare services for the humanity as we have been doing so.
That's true. So COVID has been an unfortunate and really trying times for all of us, but I feel after, as I say, the dust has settled, Department of Radiology has come out stronger, and I think a lot of things worked in our favor, EMR adaptation, clinicians listening to when we tell them to slot the cases according to infection is one of the biggest achievements. So I think we have come out stronger, and there are a lot of positives which we learned from the pandemic, and just praying that we don't see those times soon and we stick to the positives what we have learned from that. So here I'm signing off. Thank you so much for your attention and patience. Thank you.
Thank you. Thank you so much, Dr. Meinal Chaudhry, for wonderfully orchestrating this discussion. To present a small token of appreciation from our end, may I request Dr. Hira Lal, IAS Additional Mission Director, National Health Mission, Uttar Pradesh, and Additional Project Director, Uttar Pradesh State AIDS Control Society, to please join us on stage, sir. Please. Sir, if you could please present the memento to Dr. Meinal Chaudhry, Director, Radiogenesis and Interventional Radiology, Aakash Healthcare Super Speciality Hospital. May I request a memento for Dr. Sanjay Dhawan, Senior Consultant HOD, Paras Hospitals. And Dr. Sangeet Bhalla, Lead and Consultant Radiologist, Medeor Hospital. May I request the panelists and sir to please have a good photograph with the magazine, eHealth magazine, that's been catalyzing healthcare innovation since 2005. Thank you. Thank you so much to all the panelists.